Thank you, Sylvia, and good afternoon, everyone, or good morning if you're on the West Coast. It is a pleasure to be here today and joining you for part one of the two-part series around supporting H-2A workers. And as Sylvia mentioned, my name is Alexis Guild. I am the Vice President of Strategy and Programs at Farmworker Justice. And then I am thrilled to be joined by my wonderful, amazing colleague, Mary Jo Ybarra-Vega from Quincy Community Health Center. And I don't know, anything I do to introduce won't be enough because she is a Jill of all trades. She leads the outreach work. She does behavioral health. She is active in various coalitions. She has led various advocacy efforts in the state. There's just so much to say about her, and hopefully some of you may know her, and if you don't, this is a wonderful opportunity to learn more about all of the wonderful work that she does at Quincy Community Health Center in partnership with various partners, including Northwest Justice Project. So I am super excited to have Mary Jo here with me. We have done many presentations together, and I always learn something new every time. So I'm so thrilled and excited. The agenda today is we will be doing introductions and an icebreaker led by Mary Jo. And then I will do just a brief overview of medical legal partnerships in order to provide the foundation. And then Mary Jo will be sharing about the medical legal partnership between Quincy Community Health Center and Northwest Justice Project. And then we'll go into breakout rooms where we really encourage you to talk about the partnerships in your community and what those partnerships look like and steps to strengthen those partnerships. Partnerships can always be strengthened. So we look forward to hearing from you and learning about the work that you're doing in your communities. And then we'll share some resources, and then we will conclude. So real quickly, for those of you who may not be familiar with Farmworker Justice, we are a national organization. We are based in Washington, D.C. Our mission is to empower farm workers and their families to improve their living and working conditions, immigration status, occupational safety, health, and access to justice. And we do this using a multifaceted approach. So that includes policy advocacy, both at the federal level in DC, as well as supporting states in their advocacy efforts to improve the working and living conditions of farm workers. We also engage in litigation, and we also do public education and capacity building with various partners across the country, including Quincy Community Health Center. Mary Jo, would you like to introduce Moses Lake Quincy Community Health Center?
Sure. So I work for Moses Lake Community Health Center, but I work out of the Quincy Community Health Center site. And as part of our Dinámica, I'm going to go into showing you a little bit more about where that is. Then we'll have a little bit of fun to start things off with the Dinámica. And Moses Lake Community Health Center is committed to providing high quality, compassionate, and comprehensive primary healthcare services for the entire family. And this is my favorite part, with a special focus on the underserved and migrant farm workers in our community. And that's, for me, that's the heart of the work that we do here in our Quincy site, because that's the main part of the population that we serve, and will be the group that we're going to be focusing on, because the majority of the farm workers that we serve in our region, in our area, is H-2A workers. So we'll talk a little bit more about that here in a few minutes.
You want to go ahead and do the icebreaker, Mary Jo?
Yeah, we'll start with the icebreaker. And I don't know if it's possible, Sylvia, or not, but is there any way that people can turn on their cameras so I can see them? Is that possible? Or if that's not possible, that's fine, but I'd love to see them, because I'm going to do a Dinámica, and it would be great to see if people are participating. because it's kind of fun when we do it.
Yes, they are welcome to put on their cameras.
So if I can ask people to turn on their camera, it'll make things funner. How's that? And I don't know if I can see them or not, but is it possible for me to see them?
I stopped sharing my screen, and so
Yes, you
everyone
should.
is up on the screen.
Okay.
You choose
So
your gallery view.
Okay, so the good thing is I can see Alexis, so I know it's working. So I've done this before in other talks that I do, but it's always fun to talk about it because it gives you a mindset about what we're going to talk about here in a little bit later. So when I was talking about Quincy, Washington, people oftentimes they think Washington, DC. I'm going to be talking about Washington State. So I'm going to give you a little bit of a geography lesson, but you guys are all going to help me. You guys will find out a little bit more about where I live and what Washington looks like. So the first thing I'd like you to do is if you guys would all lift up your left hand so I can see it in the screen. And then I'm going to have you guys all roll down your fingers. And then I'm going to have you pull in your thumb. And then I'm going to have you turn around and look at your hand, and that's what Washington State looks like, right? So that's a good picture of what Washington looks like. And Quincy, Washington is right in the center. We're the belly button, el ombligo, right, of Washington State. So we're kind of like the heart of the state. And that's where, again, down this north central corridor is where the majority of H-2A workers in our state are located. So hopefully you guys will never forget about what Washington looks like. You guys will also remember where Quincy is, where the heart or the ombligo, the belly button of Washington State, which is a sacred spot. And again, that we have most of our workers down the north central corridor. I'm going to also have you at this point, if you would just keep your thumb up. With that one finger, I want you guys maybe in your chat to share one thing that you guys are would like to know from this webinar. Maybe put it in the chat. And maybe some of those things, maybe we can read a few of them, or Sylvia can read a few of them in the chat. So Alexis and I have an idea of things that you guys would like to know about. Maybe we can talk about that. Or you guys in your groups, when you guys break out, can remember to ask or talk about that one thing you'd like to know more about. Is that fair? Okay. And we're done with the dinámica or the icebreaker at this point. So if you guys give me another thumbs up, that's good, and we can move on with Alexis's conversation. You guys can show me the other thumbs up. All right, thank you so much. And Alexis, it's your show now.
only for a short time. But as I start, please go ahead and type into the chat, and then we will continue. So sorry, 1 second. Okay, can everyone see my screen? Perfect. Okay. So what are medical legal partnerships? So I am going to just form the foundation, and many of you are probably involved in a medical legal partnership, or have some relationship with either legal services or a health center or other community-based organization. But essentially, there are different levels of medical legal partnerships. And one level, the most basic level, is providing legal assistance. So, you know, patients come in, if you're from the health side, a patient comes in, they are experiencing asthma, and they have some kind of legal issue connected to the asthma, maybe something with their housing, and then they seek legal assistance to help them resolve that issue. And from the legal side, it can be someone comes in with a legal issue related to housing, but then you notice they start talking about some health issues and you connect them to a health center. But this is really looking at the legal side. And then another level beyond that is training. So working with staff to train each other to build knowledge and capacity and skills so that you can either make referrals or you can provide education to workers about their rights or about the ability or the accessibility of legal services or health services. And then there's that clinic level change where you kind of bring in the full clinic in order to address a patient's needs. So it's not just an individual provider, but it's the whole clinic who work together in order to address not just health needs, but also legal needs. And then that final step is policy. And that's really looking at the systematic issues that create these challenges around health and rights and these legal issues. Because as we all know, there are social determinants of health that workers face that are systemic issues that impact their health and their working conditions and their well-being. And so ultimately, it's really about those policy changes in order to improve their health and well-being. So why are these partnerships important in farm worker communities? Well, there are a number of reasons. Certainly they promote coordination of resources. And I should add, I'm sharing this really thinking about health centers and legal services, but it's not just limited to health centers and legal services. These partnerships are important across the organizations that serve farm workers. So I'm focusing on health centers and legal services organizations, but other community-based organizations play really vital roles and also should be a part of these partnerships because it really does take a whole community in order to really adequately serve farm workers, because everyone has their own resources, their own expertise, and their own knowledge about the community. So these partnerships, what they allow is they allow for coordination. As we all know, we have limited resources. And so having medical legal partnerships help to maximize these resources. And it ensures that there's coordination. So, for example, if a legal services unit is going out to provide information about legal rights to H-2A workers, they can include information about the health center during their outreach and vice versa. They also help share information about farm worker housing, the workers, the employers. Not everyone may have access to this information. This information is typically held by the Department of Labor. You can go into a website and access this information. And typically legal services does a lot of that work because they do outreach to the workers to share information about their rights. And so they can share that information with other organizations to help support their outreach efforts as well. It also encourages knowledge sharing about farm worker issues. So if there's an issue that, for example, a health center may see, they can share that with the legal services, and then together they can help address that issue. It also empowers farm workers to improve their health and living and working conditions, because not only would they be connected to health or legal, but to both. And so they have a plethora of resources that they can access in order to support their everyday lives. And then ultimately thinking about those systemic issues, working together, we can really address those systemic issues. So one example that I'm sure Mary Jo will talk about are efforts in Washington state to put in place regulations around wildfire smoke and heat. And that really came from partnerships with various organizations, including health centers and legal services organizations, as well as community-based organizations and others, researchers, in order to move forward and push forward a regulation in Washington state that protects workers from heat and wildfire smoke. Now, when we think of medical legal partnerships, we often think of the traditional medical legal partnership where you have a legal aid attorney sitting in the clinic who does intake and is part of the clinic team and is there to kind of provide that legal support for patients who may need it. Now, there are some medical legal partnerships in farm worker communities that look like that, but more often than not, it doesn't quite look that exact model. Farm worker medical legal partnerships tend to really kind of be more informal, and that is largely due to the challenges of medical legal partnerships. So many successful farm worker medical legal partnerships include referrals, cross-training on health and legal issues, policy advocacy, and board participation. So some legal services organizations have health center staff on their boards, and some health centers have legal services staff on their boards of directors. And we'll talk a little bit about why farm worker medical legal partnerships tend to be more informal in a moment. Now, there are numerous benefits, and I'm just looking at the chat just to see what people are interested in. I'm talking about health, so we will certainly talk about that. So what are the benefits for health centers? So for those of you who may be from health centers, first, it's helpful to be able to identify H-2A housing and who their employers are and when the workers are coming in. And also, you know, there are laws related to camp access, and it can sometimes be challenging for outreach workers to go to H-2A housing and access H-2A housing. So it is important to work with legal services because they can help provide information about what are the laws, like what are the rights of outreach staff to go visit H-2A workers. It also can increase the number of H-2A workers who utilize health center services. H-2A workers tend to be more isolated because they live in employer-provided housing. That housing tends to be more rural and tends to be more isolated than general farm worker housing. And they tend to not be as connected to the community because they rely on their employer to have any kind of transportation into town. And so being able to work with legal services who oftentimes are doing outreach to H-2A workers to ensure that they are knowledgeable about their rights under the program, you know, providing that information, working with legal services can help increase the knowledge and utilization of health center services. It also can help enhance screening tools. And really, it's all about knowledge sharing. You know, H-2A workers, you know, they suffer from many issues related to their occupational safety and health. And working together, you can help address those issues and address those needs of the workers. Now, for legal services, in addition to those, it can help with issue spotting. So, and identifying clients, because it might be that an H-2A worker may be more comfortable providing information to a health center staff person as opposed to an attorney for a number of reasons, including fear of retaliation. And so if they have a stronger relationship with an outreach worker or a staff person at the health center, they might feel that they have that trust and will be able to then refer that person and help identify clients for legal services so that their rights can be enforced. It also really kind of strengthens that connection between the legal issues and the health issues, because as we all know, they are closely connected. And so it's making sure that advocates who may be hyper-focused on these legal issues and questions also are aware of the intersection of health and how that impacts those legal issues that farm workers are facing. And then, of course, it also supports and increases outreach. And one reason is because health centers often have an easier time gaining access to H-2A workers, because oftentimes they have relationships with employers, and where legal services do not have those relationships. And so the health center can provide information more easily sometimes than legal services organizations. But that's also a challenge, and we'll talk about that in a moment. Of course, for workers, there are numerous benefits. Really, it's about empowering the workers, making sure that they have access to the resources that can support them while they're here in the United States, and educating workers about their legal rights, which is always really important. And it can ultimately help address, again, those systemic issues that lead to poor health outcomes for H-2A workers. So what are some of the challenges? And I'm sure many of you who have been a part of medical legal partnerships have seen these challenges. One, of course, is staffing. There's limited staffing, limited resources. There also tends to be turnover, especially with the seasonality of farm work. So staffing, having enough staff to support a medical legal partnership is often a challenge, as is funding to support activities related to a medical legal partnership. Funding is limited, just like staffing, and funding is always a challenge. It's always hard to find funding, and so having sustainable funding is always a challenge and a consideration when thinking about any type of medical legal partnership. Sustainability as well, as we think about turnover, as we think about how we can sustain these partnerships like over the years when there are changes up and down the staffing of an organization. The one challenge that is unique, I think, to farm worker communities is the impact on existing relationships. And what I mean by that is really the relationship between the employer and the health center specifically. Because oftentimes, and I've heard it from health centers, they sometimes have strong relationships with the employers in their area. And those relationships allow them to access the workers, provide health fairs, provide any kind of mobile clinics, whatever health services they may provide. And employers don't love legal services for obvious reasons. And so sometimes there is a reluctance on the health center end to engage in a medical legal partnership, in a formal medical legal partnership, because of concerns about the impact that it may have on their relationship with an employer, especially an employer who may have had some negative experiences with legal services organizations. And that is often why, when I talk about the non-traditional farm worker medical legal partnership, that is often the reason why. It's because there are other ways in farm worker communities that we have to think about medical legal partnerships in order to ensure that those relationships that exist between growers and health centers specifically are maintained. So that is kind of an overview of medical legal partnerships. And what I do want to say before I hand over the presentation to Mary Jo is that medical legal partnerships often begin with outreach staff. Often it is promotores and outreach staff from the health center and legal services, and then thinking more broadly, other community-based organizations who know each other, who tend to go to meetings together, who know each other from the community, or who run into each other while doing outreach. And that's where those relationships are often formed. And then it starts with the promotora or the promotor or the outreach staff or the paralegal, and then it builds up to other levels of the organization. But it really is the outreach staff who are really the heart and the foundation of many of these medical legal partnerships. And with that, I am going to turn it over to Mary Jo to talk more about their medical legal partnerships specifically, and also just about the role of outreach staff and promotores in advancing and advocating for H-2A workers specifically. So Mary Jo, please go ahead.
Thanks, Alexis. Alexis always does a great job of kind of framing, you know, the work that we're going to be doing. So I always love when she goes first, because it kind of sets in your mind a picture of what we're going to be discussing. And so I do want to talk about specifically today three important parts about our medical legal partnership that we have with Northwest Justice Project. It's one of the major organizations here in North Central Washington that we work with regarding worker rights, and they do all sorts of training. So we'll talk a little bit about them. But the first part I want to talk about is our history together. I'll go on and talk about some of the work that we've done regarding working with H-2A workers, and in particular, how do we work with dealing with infectious diseases. And I think the third part that I'm going to talk about is using promotoras and outreach staff, and using our community-based organizations as partners, and the strength that they bring to the medical legal partnerships, because that's very, very important. So let me go ahead and start. And again, you guys remember where I'm from Quincy, Washington. And our history kind of begins with somebody that's really important to me, and I think she's just so wonderful. Her name is Michelle Vessel. She is one of the directors in our South Central, I would say, office out of our Yakima Granger offices. And again, in relationships to that, she's kind of down in this region out here. It's not too far from where we live, but we began working with Michelle Vessel. I'm going to say it's been close to 20 years. And how we began the relationship was that we were having a promotora training in Leavenworth, Washington. And we particularly invite promotoras and community-based organizations who serve Spanish-speaking or Latinx populations, as well as agricultural workers. So we would often see community-based organizations who serve that same population, as well as community and migrant health centers in Washington State. One of the individuals who would come out and train us regarding worker rights and laws that were coming or changes that were happening was Michelle Vessel. So as a director, she would come out. I think she really enjoys coming out and spending time with us. We usually have 2 to 3 day events where we do trainings for promotoras de salud and community health workers. And Michelle and their team has consistently, almost I think every single year has been at all of our trainings, because promotoras ask them to be there. We want to be updated, and we know that Northwest Justice Project always has the most up-to-date information. And we also ask them to take complex changes in law or updates, and they make them simple. And they share it with us so that we can share it back to the community in a simple way. And I want to show you a couple of examples here in a few minutes. But this is one of the pictures of our group. I think I cut it off, but this is one of our groups that, at the training where Michelle would come, and she would often then bring out some of her outreach workers. One of them in particular that worked with us for a long time was Alex Galarza. And also they oftentimes wanted to come out and do some work with us or do trainings for us. And then most recently, we are working with somebody, his name is Ismael Lopez, a wonderful asset to the team. And we've been working with him not only on Northwest Justice Project issues, but on other issues as well. A fabulous trainer. And as a matter of fact, the picture below there with the person who's wearing the little yellow jacket is Ismael Lopez, and he's the outreach worker that we work with. And this was at our first, I think this was our first testing that we did in Quincy. It was a pop-up event that we had where we were doing testing for COVID at our high school, and it was done drive-in style. And we organized that, and Ismael came out and partnered with us to do that. And what we found at that first training with Ismael there is that our farm workers were left out of the picture. And so we were very deliberate then the next time to make sure that the Latinx population and not affluent individuals were the only ones who were invited to those first events for COVID. So after that, primarily the next population that was served, we had a huge turnaround where a lot of farm worker and H-2A workers that then started going to the testing sites. And because of the great relationships that we had over the years, this helped us to, I guess, create an opportunity. And so what was happening here at our clinic was that we were going through a remodeling process, and we bought a building adjacent to ours here. And there was an office that was not being used. And I suggested because I know Northwest Justice Project had gotten a recent grant to expand, and they couldn't find any location here in Quincy, to ask our admin if they would consider renting the space to them. And that I had to do quite a bit of advocacy, but it ended up working out really great because we could prove how many referrals we were giving to Northwest Justice Project, and that it would be advantageous to our patients to have and to help break down barriers for them, especially those farm workers, to be able just to refer them right here, right close. We could walk right across the street and we could refer them. And so that was something that we did. And we have been renting that location to them for probably for a very small amount. I won't tell you how much that is, but a very small amount, so they can be here. And we have continued having a really great relationship with them. So that's kind of our history with them. And if we can go to the next slide. One of the really important ways that Northwest Justice Project and Quincy Community Health Center work together is how we help to mitigate COVID-19 and H-2A workers. So when COVID began, one of the things that happened is I started getting phone calls from different people. And again, COVID began actually in Washington State when we had an individual who had recently come from China. He was the first person who was positively identified as having COVID. And it very quickly started to snowball. And one of my compañeras, one of my friends, her name is Ms. McCormick, she and I started talking, and then at that point I started getting phone calls from people like Michelle Beso, from other legal programs like Northwest Immigrants' Rights Projects, Columbia Legal Services. People started calling me and said, "Hey, Mary Jo, have you heard about what's happening? What's going on?" And I said, "Yes, I'm very concerned." And we said, we know that the Latinx and the farm worker population and our H-2A workers that are coming in are going to be the most affected population. And so instead of reacting, what we did is we began being planful. So we started creating training curriculums to teach workers and Latinx populations. And one of the things that we ended up doing was working with Northwest Justice Project to have them help us create documents and have them help us create training programs for H-2A workers regarding H-2A that met all the CDC and HRSA and our state rules. And so they were very helpful in that process and also accessing services for the patients that sometimes we would bring to them. One of the things that they do that they're very good at is that they create information for us, and I'm going to show you one of them. This is a recent one. It's called El Faro Legal, and it is a wonderful magazine, or not a magazine, newspaper. And this is the kind of newspaper you don't throw away because it has lots of valuable information in it about worker rights, wages, locations of clinics and community health centers, different laws and services that help farm workers and also H-2A workers. One of the other things that we do together is that we have created for several years now is a calendar. Here's a calendar from 2010 and 11. That's some of my pictures, and that there's some of the people that we got to help fund this project. And the calendar every month has different topics in it that we educate and that Northwest Justice Project wants to educate people about. And one of them looks like this. And it's trabajadores locales, and it talks about H-2A worker. And basically every month there's an educational piece on it. And it goes along with not the regular January through December. It's basically based on the agricultural year for farm workers. So this is another piece that we share out. And what I really like about this piece when we're talking about medical legal partnerships is that on this first page, or on the back page, Northwest Justice Project will always give information about how to access clinics and community health centers and helpful information. So this is not only a calendar, but of information piece that we use, and Northwest Justice Project and our offices put this piece together. So this is a really great calendar. So this is one of my favorite ones, so I thought I'd show that one to you. Other things that we do together that Northwest Justice Project does is that they do trainings for us. This is one of them that they did recently for us, and this is about trafficking. So this is a really informational one that even some of our providers here from our clinic on their off day, they actually showed up at that training and they were amazed at the information that was shared. So maybe we can go to the next piece or the next slide. And I did want to say something that before I start on this slide that Alexis alluded to a little bit ago was that one of the things we also did with Northwest Justice Project is they helped us create and supported a farm worker phone call that actually Alexis Gelt helps coordinate along with Northwest Regional Primary Care Association and Moses Lake Community Health Center. We hold a farm worker support phone call, and it was those phone calls that I had with those attorneys that then later on became a phone call that several organizations across several states join, where we have been talking about how do we support each other during COVID, how do we support the farm worker community, H-2A workers, what are hot topics, and also what are items that we should be addressing. During one of those phone calls, one of the issues that came up that was not COVID was that we had patients who were coming up with COVID. They were wearing masks. It was 100+ degrees and there was smoke. So it made a really bad situation worse. And we decided that we could not address heat and wildfire smoke when we made those farm worker calls. So we created a ad hoc committee that would then begin to address heat and wildfire smoke issues. And we came up with a proposal called the Western State Pact. And that pact was meant to be a catalyst for the rest of the country for us to have the same smoke rules to protect workers and the same heat rules across at least our states, Western states, to protect workers. Because right now, all the rules are different across the country. And when workers move from state to state, they do not know what the rules are. So our work was basically, please act together as the Western states to make sure that our rules are as close as they can be, and to make better rules to protect workers. So that was kind of some of the work that we did with Northwest Justice Project. And I think the one thing I want to say, and this is something that Alexis also discussed, was that great relationships can also be complex. Everybody knows that, right? And so some of the complexities that we have, and I think Alexis again spoke about this, is that we can't always take Northwest Justice Project outreach people with us, because agricultural employees are, you know, they're a tough group, they're tough, and you have to have trust with them. You have to prove your work to them. And I often tell growers that we're not the cops. We're not going to go out and get you guys in trouble. We're here to help you guys. And in the next slide, not right now, but in the next slide, there's a key line that I use, and it's basically, you as workers or as employees have the same goals that we have. We want strong, healthy workers, and that's where we meet. And so oftentimes they don't want us to bring Northwest Justice Project up, because they sometimes are seen as the cops. We're not. We're your friends. We want to keep your workers strong and healthy. And so sometimes we can't bring them out all the time, because it will sometimes hurt the relationship that we have already, the trust that we've built. Oftentimes, Northwest Justice Project, as well as Quincy Community Health Centers, our center, we only have a very small crew. Our crew is, I think Alexis shared the picture. Basically, we have we don't even have two full-time. I'm the only full-time person in outreach right now. We have somebody who works 3/4 time, and then the other person works half time. So we have very small outreach teams. And then Northwest Justice Project, they have just a few people in their organizations to cover most of the state. So that's another complex situation. And so we're very thoughtful about when we do come together. The other thing that we also talk about is that sometimes once we turn over cases, for example, to Northwest Justice Project, we don't know what happens, and that's because of privacy rules. And then oftentimes the same with us. If Northwest Justice Project brings us an issue with the worker and it becomes a medical issue, again, we can't share information back with Northwest Justice Project about what happened, right? It's a HIPAA violation for us. And so sometimes that relationship, we have to understand when it starts and when it ends. And sometimes it's vague, right? So I think that's one of the difficult pieces, but I think you can work through that with medical legal partnerships. Also, we cover large areas, rural areas, and I think Grant County is one of the largest counties in our state. And you know, we might be driving several hours until we hit the end of our county. So we cover lots of space and lots of rural space. And for some of you guys who know working with workers, when you work with H-2A workers, the way that it happens here in Washington, employers hide where H-2A workers live. They'll put farm worker housing way in the middle of an orchard, so you can't see them. It's hard to get to them. It's hard for them to come into town. They don't want community members to know that there are H-2A workers in town, so they try to hide them. They isolate them. I don't know if it's done willingly or thoughtfully or in process, but it feels like to me that they're trying to hide their housing. So that's difficult. So sometimes when we go out and do outreach, we have to go scout where the location is because not even GPS will know where they're at. Let's see, and then we are, I mean, as a clinic, we have a catchment area, a certain area that we can work within. And so sometimes we're not allowed to go outside of our catchment area, which is Grant County. There are a few exceptions where Northwest Justice Project can cover all sorts of areas. So if Northwest Justice Project wants us to help, sometimes we can't because we're not in that location. And then I think the other part is that I think we had a situation one time where somebody from Northwest Justice Project, one of their workers or a student, I believe, came and did some work in our catchment area. And I don't know what happened, but our boss got a phone call that somebody was out making trouble or causing trouble with their workers at their camp without permission. And we're like, well, it wasn't us. And so we ended up finding out that it was somebody from Northwest Justice Project. They had the right to be on campus. They were invited. But we had to make sure that we went back and mended that relationship and clarified who was out there. So those are some of the challenges that we face sometimes with our Northwest Justice Project hermanos and hermanas, our brothers and sisters from Northwest Justice Project. If we can go to the next slide. One of the things that we also try to work together about is creating medical homes for H-2A workers. And what I mean by a medical home is that oftentimes people coming from third world countries, you know, some of our H-2A workers might be coming from Central America, South America, sometimes from Jamaica. We've had some other people from truck come into our area as well. And so if they're coming from third world countries, their view of how medicine work is different from how we see it here. So that's important to know. And so one of the things that we try to do when we go out and talk to workers, especially H-2A workers, is talk to them about having a medical home and having one place you go to the doctor. You have one lead doctor, one person that takes care of your health here, because many of the workers are here for 10 months. And I think that that's really important. And I'm going to go into the next page if we can, because I know I just have a few minutes left. I wanted to make sure that we have enough time for you guys to talk and chat. And here are some pictures of some of our outreach work that we do with some of our promotoras. And by the way, some of these pictures that Alexis and I are sharing are from a wonderful and very famous photographer, photojournalist. His name is David Bacon. So if you guys want to look on that, these are pictures that he took for both of our organizations when he was here in Quincy, working with us for I think a week or so. And I think that was worked out with Alexis. So we're happy to share these lovely pictures from him. So some of the example that we do with prevention work, and I'm just going to give you a few examples, is when we do go out and do work with H-2A workers at labor camps, we will talk about sexual health in depth with them, and about what some of the local sexual health issues are in our area. For example, in Grant County, syphilis is a huge issue, so we'll talk about that and what treatment looks like, and how and when they should get treatment before they go home. So that's really important as well. And we'll also talk about using how do you safely and appropriately use protection. We also will talk about food safety issues, where to put food, how to store food, because oftentimes that's a little bit different. And then like not putting their eggs, their huevos on top of the refrigerator, they need to be inside the refrigerator, right? And then of course, we've talked about COVID and created actually a whole curriculum. And that was very successful in our state. And we actually, Alexis and I just finished jumping off the Farmworker phone call that I spoke to you about. We just jumped off of that. And I was really, I was very humbled, I guess, by an observation that our coworker or somebody that really care much about, that works for the state, that talked about the work that we did, about how we helped mitigate COVID with H-2A workers. And not only was it was a state success, but it is recognized as a national best practice. And I know that some individuals are getting ready to publish that work. So, you know, I think that's some really great work that has come together with working with Northwest Justice Project. And again, working to prevent infectious diseases. I think there's so many things I can tell you that we've done with Northwest Justice Project. I think the other thing that's really important I haven't shared is that our relationship, I think, goes beyond just working with workers. I think we truly love doing what we do. I think we both feel like it's an honor to work with H-2A workers and farm workers. Most of us come from farm worker backgrounds, have been farm workers ourselves, or sleep with a farm worker, or our parents are farm workers. So it's very heartfelt, the work that we do together. And I think that we have a special spirit working with that population. And of course, we use magic people like promotoras de salud. There's a picture of one of my compañeras, Imelda, that true promotora de salud, very well trusted in the community. And I think that Northwest Justice Project recognizes that hiring people like Imelda that have that trust in the community, or working with promotoras that we have, it's magic. It works. We know it. If you went through, you know, I saw a lot of líderes campesinas who are on the call today. You know, those kinds of organizations that have trust in the community, absolutely essential if you want to have, you know, success in the programs. And I'm hoping, and I think it's true that our government, state government, and federal government now recognize that promotoras de salud are essential workers. They are necessary and can make the difference during a pandemic. We proved it. And so I'm so proud of the work that we do, again, with Northwest Justice Project, and having that relationship. But again, I think it also becomes a personal relationship, and we become close with a lot of the Northwest Justice Project staff. So that's the last thing I guess I want to leave you with before I turn it back over. And I think we're probably going to be moving into breakout sessions, so you guys can talk a little bit about what some of your guys' goals are regarding your medical legal partnerships that you have, or ones that you would like to create. So let me turn it back over to me, amiga Alexis.
Thank you, Mary Jo. And that was such great information. And I just want to also share in terms of, you know, workers' compensation. You know, workers' compensation is extremely complicated. But I think, you know, having that partnership with legal services and with community organizations and health centers can help navigate that workers' compensation system, especially because in many states, farm workers don't have the same coverage of workers' compensation as other workers, but all H-2A workers have workers' compensation coverage. So, but it's complicated. It's also challenging because of, again, fear of employer retaliation, because visas are tied to the employer. If they're injured, they may be sent back. Thinking about the continuity of care. And we'll actually talk more about that during our second webinar, about kind of more of that clinical piece of what happens, you know, how do you help support them, you know, through the clinical process, thinking both in the US and back in their home country. But that's just a preview for the next webinar. But for this webinar, you know, again, you know, having those partnerships and making sure that both the legal services and the health center and community organizations, that they all are aware of rights, is really important to ensure that H-2A workers especially are able to, you know, be healthy and able to return to their home country with the wages that they were promised, you know, and ensuring that it was that they were here to do the work that they were brought here to do. So being able to share that information amongst each other, but also with the workers, is vitally important. So with that, we are going to go into breakout rooms, and we'll have about 15 minutes in the breakout rooms. And really, the breakout rooms are an opportunity just to, you know, share with others your experiences working with either health centers, legal services organizations, or community-based organizations. Some questions to think about when you're in the breakout room. Do you have a partnership in place, a community partnership with any of these entities, health center, legal services, other community organizations? What does that partnership look like? Is it a new partnership? Is it a successful partnership? What are steps that can be taken to strengthen that partnership? So those are some questions that we would encourage you to discuss in your breakout rooms. And Lisa just shared some instructions in the chat. So for those of you, there'll be breakout rooms, and we ask you to select someone to facilitate the conversation. We also will be coming back afterwards, so please select someone who can share the discussion with the group and what was discussed, so we can all kind of share and learn from each other. And for those who are more comfortable in Spanish, you will stay in the main room, and then others will be sent to breakout rooms. So Lisa, if you want to go ahead and set up the breakout rooms.
Alexis, the rooms are set. I will go ahead if you're ready and open those up.
Yes, please do.
Okay.
And what I was telling Joanna was that one, is important to know what some of the rules are in your state, and those medical legal partnerships, that's where it's really great, because they can tell you what the rules are. How can you access? Do you have the right to access? And under what circumstances can you access? And what I was going to mention to Joanna is that one of the strengths with our medical legal partnership with Northwest Justice Project is I can go to Alex or somebody on our team, and they will tell me, if you want to know where they're at and how many workers showed up, and if they did show up, they're going to be able to tell me where to get it, or give me a link, or make the contact with me at the state, or with maybe the grower or whatever, so I can find that information out. The one other thing I was going to say to the group was that when you don't have access, we're creative. Las promotoras son son bien listas. They're great. They're wonderful. We actually have a promotora, the person that you guys saw a picture of, Imelda. She's actually a TikTok influencer amongst Latinx and farm worker populations. So what we've done is we've kind of created a roundabout way. So when we want to get information out, we can have her, through her TikTok account outside of work, access that. And the clinic has actually used and making commercials, and they put it on her TikTok account. So for topics that we want to get out. So that's another way for some of you who don't have access. Find out where the workers, what accounts are they using? What page are they on? What's really popular, and ask if those individuals can get information to workers or get the rules out or do a short little commercial. I know that Alexis and our organization did a commercial about insurance. Maybe Alexis can put it in the chat so you guys can see una video novela that we created about insurance. So I think using social media has been helpful to us to access that. But maybe the group that I was in can share some information. Yo sé que our translator was going to share some of the. Sí, iba a compartir. She was going to share a little bit of the discussion we had. And then after she does.
Ahí nomás es junta de la mesa.
¿Mande?
Ahí Paola va a tener el voto. Ya te dije, tú siempre vas a hacer como si ella no está porque ya se va a meter a una hora. No, tú nomás te calladita y vas a ver cómo se dirige la mesa. Va a ser tu primera llamada. Tú vas a...
Can we?
Yesenia, te estás escuchando todo.
Si quieres apagar tu micrófono. Thank you. Entonces, after maybe we have the translator from our group share out, and then we can come back, and then the next group can share out. Would that work? Y yo sé que fue la traductora la que iba a tomar nota. She said she was going to share out for the group that I was in. If she wants to do that right now. Se puede. Soraya, bueno, gracias, Soraya, sí. We can't hear you, Soraya. I think you have to unmute. No? Can somebody give her access so that we can hear her?
Can you hear me? Mi nombre es Claudia. ¿Sí me pueden escuchar?
Yes. Soraya?
No, soy Claudia. Estaba en el grupo 1, el room 1.
Okay.
Y solamente quería compartir porque sé que está batallando la traductora. Que lo, or should I say it in English or Spanish? English is good?
Yeah.
Okay. Yes, what I got from room 1 is that I think everybody kind of understands the importance of these partnerships, right? Of creating them. But what I noticed from the people that spoke was that they're having trouble creating the partnerships. Como que it would be super valuable if we could share resources from our areas, you know, and to be able to, like, somebody who's in Georgia get together with somebody who's in Georgia that maybe does health, and then the other one does legal, because that's what I noticed, that they're saying, you know, I have health or I have this, but I'm having trouble getting someone to help me with the legal part or these other things. And that's what, from the notes that I took in that room, I feel that that's one of the major things. They wanted to create partnerships with people and, you know, to be able to access the H-2A workers without destroying what they're able to do. Like the health ones, you know, they're able to reach out, but they don't want to get too involved with legal because then the employers will get upset and not let them continue giving out those services. So it's like creating the partnerships and then finding a way to work together to continue providing the services that each of them has to provide.
So did it seem in your group that what people wanted was maybe a list of organizations that would enjoy or would like maybe like a list of all the legal organizations in your per state? I don't know, maybe Alexis that works with Northwest Justice Project has a location or a place where she can, or, you know, the organization who's holding this call, maybe they can share out some links where they can share all of the legal partnerships or legal aid individuals that do work, for example, like Northwest Justice Project or Northwest Immigrants' Rights Project, so that we have a list of people or organizations that might meet, you know, might be that organization that we could team up with. Because I think, yeah, does that sound like something that would be helpful?
I think for sure, definitely. And also resources like the links that you all shared and like, oh, if you look at this website, you can find this information. So I think definitely like sister organizations in our areas and like links, resources, that would be great.
Yeah, and I think, Claudia, the other thing I was going to say, and I know that the host organization, as well as Alexis, could also share information and links with you guys nationally about all of the community health centers and migrant health centers across the United States and the territories in Puerto Rico and some of our some of our territories and islands. So that would be a good link for this group too. So you guys know, you guys might not know that there's a community health center or a legal aid service or those organizations that do help support farm workers in your area.
Correct. Yes, that would be great, I think.
Yeah, and I don't know if that's something that, again, our host organization or Alexis's group could put in share a link, or afterwards share a link in the chat with us. Was there anything else, Claudia, that came up before we move to the other group?
For me, that's all I had to share. I don't know if somebody else would like. Thank you.
Thank you. So can we go to the other group? And I don't know if we can have the interpreter unmute, because she was going to report back. And if she can't, maybe somebody else from the group can share information, because I jumped on late. Soraya, can you? I was just gonna. Soraya,
Soraya is in the Spanish channel.
Okay, so could we have
the
somebody
general
else?
audience is unable to hear her.
So Joanna or somebody from our group, can you guys share out what was shared in our group? ¿Se puede?
I was thinking that Claudia was in our group. I'm not sure. But anyway, no, the same thing as Claudia said, because, you know, some of us are scared that if we partner live with the Department of Labor, the employers say, yeah, you can come, because we have that happen to us when we go with migrant education. Oh, sometimes they say they're here to work, they're not here to learn anything. So, you know, that was the partnership that we have some issues. You know, we love to work together, but some organizations are not welcome as you are. So that, you know, we don't want that. And then something else I hear, and I would like to hear more information about the rights of the H-2A workers, because some of them are also scared to say anything, because the next year they will not renew their contract. So a lot of them stay silent. So we, like I said, provide health services for the farm workers. So I would really like to speak with someone that will let me know more information about their rights and what we can share with them.
Joanna, I was going to mention, if I were you, I would, maybe Alexis can share the link that, from their organization. They have wonderful cheat sheets and talking points about rules and laws for farm workers and H-2A workers. And maybe that's something that Alexis can share, or you guys go to their website, the Farmworker Justice website. They have a lot. They have videos. They have there's other really great organizations that have information about for H-2A workers, and maybe again, maybe our host or Alexis can share out some of those connections for you guys, so that you guys can see what some of those rules are and that exist. And no es por nada, my amiga Alexis is really good in this area. So she's a really good point for you guys. So get her email. She's very accessible, habla español. So, you know, she's a really great point of reference for you. And any of you guys who are on the call and you guys would like to call me or talk to me about how to start that relationship, I'd be more than happy to do that.
And last year, and Lisa, I don't know if we can put the link in the chat, but last year NCFH hosted a webinar that discussed the rights of H-2A workers. So it was an overview of the legal protections for H-2A workers. And I know that's on the NCFH website. So I don't know if Lisa or Sylvia could also include that link as well. Olga, I see you have your hand raised.
Yes, hi. Yeah, that would be great. This is great information to know, that we can partner with each other and try to help, the workers. But my question is, why just the H-2A farm workers? Why not all the farm workers?
Yeah, this is Robert Blackwell.
Olga, I'm not sure I can hear somebody else's voice, but I hope you can hear me. I think that this call in particular, I think because of the title, that's why we were focusing a little bit on H-2A workers. But our medical legal partnerships not only covers H-2A workers, our medical leadership partners all the Latinx community, but in particular farm workers. And H-2A workers is a particular group. And so you, as well as I know, as being advocates, that it's important for us to know both what are the rules for H-2A workers and their issues, and then what are the local issues for our local farm workers or migrant seasonal farm workers, what are their issues. And sometimes, I know you guys know this, they clash. The system's been set up so that those two communities clash. So how do we do it to work with each of them? And sometimes there's different skills. And I think that if you have a really good medical legal partnerships, they understand the nuances between those relationships. So that's also a very important thing when you guys are looking for relationships. But I think some of you guys are talking about working with state agencies or federal agencies. I really recommend working with those not-for-profit organizations that are legal aid services for low-income, immigrant, and refugee, asylee status. Looking at those legal aid partnerships, those have been very successful here in our state, at least. So, and I do agree with Joanna. We're partnering with some of those people, it doesn't work. You don't want to take some of those folks with you because it will ruin the relationship that you set up for 15, 10 years. So I'm glad you guys are thinking about that. So sometimes you can't take your friends out with you. You use them to get information, you use them to train you, you have them create materials for you and the population. That's how you can use them. And then they're going to use you too, because they're going to gain access and information from you too about what's going on in the field.
Well, I hate to end this conversation, but we are at time, so I want to be cognizant of everyone's time. But it seemed like there were some really good discussions in the breakout room. So that is wonderful, because that's always one of the most valuable parts of these webinars. I'm just going to quickly finish us up. We do have resources on our website, as Mary Jo shared, and there are also resources on the NCFH website. Last year, we did a series of webinars on outreach to H-2A workers, as well as an overview of the H-2A program and the protections that H-2A workers have while in the United States, as well as their healthcare rights specifically and how they access healthcare in the United States. So those webinars are archived, but we also have these resources as well. We have lots of materials in English, Spanish, Haitian Creole, as well as Indigenous languages available on our website. Thank you so much for joining us. Really appreciate all of the great conversation. Thank you, Mary Jo, for sharing all of your insight and expertise with all of us. It's always wonderful to co-present with you. So thank you so much. And Lisa, well, Mary Jo, I don't know if you have any parting words before I turn it back to Lisa.
I just wanted to thank everybody and trust your guys' intuition. You guys are doing a good job. Be creative. I think that's the one thing I have to say. Just be creative about how you create those partnerships. It doesn't have to be full blown. It can be a small relationship, and then you guys make it grow.